Good morning, people of the internet. I figured I would vlog today because today there are some things happening. I am having a couple procedures done and I want to vlog it because I didn't know anything about these procedures until my doctor said, hey, you need to make an appointment at Minnesota GI, which is where I'm going a little bit later, and do these things. So anyway, I'm going to work, and my work is pretty close to Plymouth, so that's why I'm going in for this morning. And then I'm going to my appointment, and then after that, the plan is to go back to work. Sorry, my my throat is still quite hoarse from my previous surgery that I just had. So anyway, so I am going to a place called Minnesota GI, and I just wanted to tell you guys what I'm getting done, and then I'll write it in the description box below because it's like very strange. So the first thing I'm getting done, which will take about an hour, is esophageal mobility, or it's called manometry. It's a procedure that enables the doctor to evaluate the muscles in my esophagus. It's performed by passing a small flexible tube through my nose into my esophagus. Once the tube is placed, it allows the muscle activity to be assessed. This procedure is used to help diagnose patients who suffer from chest pain, heartburn, acid reflux, and difficulty swallowing. I don't have difficulty swallowing. It is also used to measure the pressure of the muscle at the lower end of the esophagus before surgery. So that's kind of why I'm getting that done. So anyway, that is gonna take about an hour. I guess the actual procedure only takes like 15 minutes, but like the prepping and stuff. And then after that, I'm doing this 24-hour pH monitoring test. And that is gonna be interesting. The 24-hour pH test is to help your doctor determine if you have acid reflux by determining the number of gastrophilological reflux episodes, which means the backward flow of the stomach's contents into the esophagus. It also determines the duration of each episode and what the acid measurement is. So this is what's gonna happen during that procedure. It says a registered nurse will pass a very thin tube through my nose into my esophagus. The tube will be secured to my nose with tape at the end and be attached to a small recording device, which you can wear on a belt around your waist or carry it like a shoulder strap. For 24 hours, you'll be asked to keep a diary of what you eat, or when you eat, sleep, and any symptoms that you experience, example like coughing or heartburn. So I am no makeup Emily today because they're gonna tape crap to my face, and I figured I don't wanna really do that. So, but the other really crummy thing is I can't eat or drink anything for 6 hours prior to my procedure, and my procedure is at 9:30. So I can't eat or drink anything this morning, which kind of sucks, but that's okay. Another really crummy thing is that all my acid reducers I had to stop taking a week ago because they wanted to get my stomach extra bubbly, I guess. Yeah, the burp. I'm not gonna edit that one out. Oh, I have so many burps. Anyways, so since I haven't been on many acid reducers, my stomach has been very bubbly, and thankfully I could still take Tums at night to kind of just like get me through. But last night I couldn't take any Tums, which really sucked, the big one. So I had a really difficult night sleeping, and I'm not sure if I can start my acid blockers tonight, even though I have the monitor in. I don't really know. So anyways, hopefully I can start them again tonight, because last night was just a bad sleeping night. So anyway, I have my paperwork here, and I am going to go to work because it's like 6:15. And oh, they told you to wear a button-down shirt, so I'm clearly wearing like a t-shirt underneath right now, because they said it would like hinder your ability to change your clothes or something. So I don't know, I can always take this shirt off and then just like button this up because, you know, nobody needs to be flashing anybody, you know. So anyway, I have about an hour drive to work, and I usually drink my tea, but I can't have that today, which really sucks. But oh well, it's like the weird things that are, you know, like in your routine, you're like, wait, I can't drink the water. I can't, you know, eat the breakfast or whatever. I will show you what I eat today as well. And I did pack a lunch. I have a lunch bag right here. So I have a Coke in there because I feel like I'm gonna need some caffeination at some point. And then I have some cinnamon applesauce, and then I have a small piece of lasagna. So I'm not sure if I'll be able to eat the lasagna or not, so that's why I brought the applesauce. So I'm gonna bring this as well to the work situation. And let me show you guys Doyle, because he's waiting for his cookie. There's the Duber. All right, so anyway, I'm gonna go to work and I will see you guys again when I have a hose up my nose. Bye. So I am all done at my appointment. I know I look really crazy, but so yeah, so this is what I have to wear for 24 hours. Funny enough, the other test that I got done, the manometry test, esophageal manometry, that one did not feel good. Not that this feels great, but the tube was a whole lot larger, and I had to swallow and then not swallow, and the nurse had to like watch me drink a bunch of water and then drink a bunch of salt water. So anyway, this is really flexible and really thin. The worst part is when they go up your nose, like the hook to go down into your esophagus, that is the worst part. So I just kind of like zenned through it, and she's like, yeah, you did great, like I have all this extra time now. I'm like, oh, okay. Because I guess normally it takes quite a long time to do this, and my check-in was at 9:30. And it's not even 10:30 yet. So one of the procedures was supposed to take an hour, and it didn't, because I just kind of like zenned through it. So anyway, I'm just supposed to start eating and drinking like normal. I have my information here. So I'm trying to cover up my info. But yeah, so this is my like little chart of eating and stopping eating and whatever, and then I've got these little like buttons on here to push when I start and stop eating, and then also when I'm burping or feeling refluxy. So anyways, but yeah, I'm gonna go back to work, because I mean, who doesn't want to go back to work looking as sexy as I do? And yeah, that's what's happening. So I will see you guys when I start eating something. And oh, this shirt is like, it's too big for me. Anyway, but I will see you guys when I start eating. The other thing that they talked about was to try to avoid snacking if possible, because it's just more difficult, because you have so many like entries for the like eating category, and even like drinking is like an eating category. So you still have to keep pressing the monitor. Anyway, and then when I sleep, I need to push the sleep, and then when I wake up, I push the sleep thing again, and just so they know what I'm doing. So yeah, that's fun. So anyways, okay, I'm gonna go, and I will talk to you guys when I start eating something. And oh, sorry, I keep like too many things. And she said, eat all the bad things for me. So like, eat all the things that make your reflux or make your stomach all gross. So yeah, I am going to do that today. So yeah, that's what's gonna happen. And I don't know if you can see, it's gross, but you can't see, but this is in the back of my throat as well. But it's very flexible, and it's really not too bad. I feel like it's gonna be the worst when I'm actually eating. So anyway, I'm gonna go to work now, and I will see you guys in a little bit. Well, hello friends. I'm sorry I did not check in with the food situation this afternoon. One of my coworkers actually decided to eat lunch with me in the lunchroom, so I didn't really want to like whip out the vlog camera. But anyway, I did eat my lasagna. I also had some applesauce that I ate, and then also I had a Coke. So that was good. It is very like, it's like this weird tight feeling, you know? I don't, no, you guys can't see. I thought maybe you could see, but I need to like, you know, be in a better lighting situation, and my car is clearly not ideal. So anyways, but a few hours later I did have another Coke because I usually am a 1 Coke a day kind of a person. I don't really, you know, do too much caffeine after that, but I decided let's whoop it up and let's have another Coke because, you know, the gal was saying eat the things that actually make your stomach, you know, have problems. Cokes don't really make my stomach have problems, but you know, it's like very carbonated and bubbly and very sugary and stuff like that. So anyway, my reading currently is about a 5, but I also haven't eaten anything in a while. And like I guess the normal pH level is a 7 of where you kind of like want to be, and then I've gotten all the way from a 7 at the very beginning and all the way down to like, and this is only when I have seen it, I've gotten down to like a 1.7 as well, but it just keeps fluctuating all the time. So anyway, but it's going good so far. I am not looking forward to the sleeping situation, but I'll keep you guys updated on how I deal with that. But I am gonna go home. I am going to give the mother a call. I did talk to her just a little bit on my way back from my appointment, just to say hey and it's in and like all of that stuff. Where is my phone? Ugh, it's in here somewhere. Here it is. Like I have so many papers in my bag, and I normally don't have hardly anything in my bag, but I have all my instructions and things to, you know, look out for. So anyway, but I am gonna go home, see Doyle, and figure out some greasy thing to eat for dinner. I don't know, I might like just go through a drive-through or something and get some like a burger or something like that and some fries. So I'm definitely gonna feel real icky tonight, and I'm gonna feel real icky tomorrow because no acid blockers for this girl. Anyway, I will see you guys when I get home. Okay, so I am home. I gotta get rid of this stuff, but Operation Make My Stomach Bubbly is on. I got some McDonald's, and I'm probably not gonna eat it all, but I just wanted, you know, to make the stomach bubbly. So anyway, I got a cheeseburger, which looks like it's already been eaten, but it hasn't. It's not, I mean, it's like the wrapper's coming off. And then I also got a 4-piece chicken nuggets with my favorite barbecue sauce. So what irritates my stomach the most, which I should probably talk about because you guys are watching this, is like red sauced products, like marinara sauce, barbecue sauce, ketchup, but actual tomatoes don't irritate my stomach, but like tomato based sauces and products do. So anyway, Doyle is down there. We just went on a walk, and of course my neighbor was outside, and he's like, what's up with you? I'm like, oh, just, you know, another Wednesday. So anyway, talked to him for a little bit. But anyway, well, I am going to eat while the food is still a little bit warm, and yeah, that's gonna be it for the moment, and I will check in with you guys when things get a little bit more interesting. All right, so I am ready for bed. Took me a minute to figure out how to get a shirt on. It took a moment. But anyway, I figured it out. We're good to go. This is on the outside of things. And I got my little bed kind of set up a little bit. So I'm actually gonna be adding another pillow to this, and I'm just gonna try to sit up as much as possible, which I know is like crazy, but that's just what I gotta do, you guys. So anyway, it's quite early still, but I am tired, and I'm just kind of burnt out for the day, you guys. But anyway, I will check in tomorrow or maybe even this evening. If things get, oh geez. If things get like a little weird, I don't know. So yeah, I still have this, still have this guy on me. And yeah, I don't know. Doyle's very interested in it right now. But hopefully he'll just leave it alone, you know what I mean? So, like I said, no Doyle, stop. Anyway, like I said, I am going to just call it quits for the night. I will check in with you guys if anything crazy happens, or I'll probably just give like a recap in the morning, anyways. So yeah, okay, that's it for day 1-ish of this, and I'll check in with you guys later. Oh, by the way, I had to redo my tape over here. I have you know, skin tape. What is it? Skin tape? I don't know. Medical tape here. So I just had to redo this one because the other one had kind of come off, which is totally normal because it's like, you know, hair and skins. So it'll probably have to redo that one later too. But I don't think I'll have to redo this one or this one tomorrow. So that's good. But anyway, Doyle and I are gonna go, and I will see you guys in the morning. Bye. Hey, so I know I just said I wouldn't talk to you guys until tomorrow, but it is just about bedtime. Got my sound machine on. Doyle's doing his Doyle dog thing. And I just wanted to show you guys like how I'm sleeping. I have so many pillows, and I'm basically at like a 45-degree angle, basically. I can't take any acid blockers or reducers right now, which really sucks because I've been without them for a week now, or over a week, and I can't take any Tums either because that's gonna, you know, mess with the situation there. But anyway, so I was thinking, I'm like, how am I gonna sleep with this freaking thing? So what I'm gonna start off by doing is I still have my thing on. It can go over my waist too, but I feel like that'd be kind of uncomfortable because I tend to kind of like move around. I don't know. And what I don't want to happen is that I wake up in the middle of the night to go to the bathroom, because I always wake up in the middle of the night to go to the bathroom. Doesn't matter. And I forget that I have this like pack with me, and I just get up and start walking, and then it like, you know, pulls it out. We don't want that. So I'm gonna just hang out with it right here. I might eventually change it to my waist. I'm not sure. I feel like that'd be, I don't know, kind of uncomfortable, but I don't know. I might try it out too. You never know. Just depends on how this goes. Doyle is usually pretty good. He's eating a bone or something right now. Normally I don't allow that in here, but you know what, just pick your battles, you know what I mean? Anyways, normally he's pretty good at sleeping. Well, we all know that, right? And so he typically doesn't like come up to me and like paw at me or anything. Normally he does that when I'm like awake. So and if he wants something in the middle of the night, he'll just, you know, bark or cry or whatever. So he knows that that gets my attention just fine, because he's not like he's not a snuggly puppy at night. Like he doesn't like, well, once in a great while he will actually like come right up to, you know, the edge of me, but hasn't been recently. And I actually have like a pillow here and a pillow here, so he would only get about this close. So I just don't want him to get too close to this, and then also, you know, like one of his nails snag or something on that. I don't want to do this again. So anyway, all right, I am gonna attempt to sleep. Wish me luck, and I will report back in the morning. And Doyle is eating his paw as well as his treat, so yeah. All right, I will see you in the morning. Good night. Well, hello, it is the morning. Doyle's there. And I slept like crap. So anyway, going to work now. I've got my appointment, or not appointment, you can just walk in at 10 o'clock. So that's good. But I figured I have a little time right now and I wanted to, don't mind the monitors. I'm trying to get some stuff figured out for my office. So I figured I would answer some of your questions because I asked if you guys had any questions about this, and a lot of you had some questions. So I'm just gonna like rapid fire answer. Hopefully I'm not gonna get too wordy. First question, when do you get the results? They say 2 weeks, so hopefully 2 weeks. And it says, also another question, was it uncomfortable to sleep? Yeah, yeah. The most uncomfortable part was actually this. Because I was so concerned about my wires and, you know, all that jazz. So yeah, it was not comfortable at all. However, I did get a little bit of sleep, but I only got about, I would say like 3 solid hours. Like I didn't sleep very well, but I'm not a good sleeper anyways. All right, next question. What stomach issues are you experiencing? I have issues and I can't figure out what's causing it. Okay, so I am having really bad acid reflux. I also have already had an endoscopy, which is basically they put a tube in your throat, they kind of put you under, and then they explore what's going on. So I've got a lot of stomach acid because they could see that in my stomach lining. And then I also have a hiatal hernia that I need fixed. And this is part of the fixing situation. So this is basically to prove that I have a problem and get the results to my doctor and whoever my surgeon is going to be for the hernia surgery. And then also the other procedure I had done earlier that, you know, is for your strength of the esophagus. That is like a pre-surgical thing because they want to make sure that you have a strong esophagus to, you know, do the procedure. Oh, and then someone asked, what's wrong in general? I haven't been up to speed on it. Well, hi. So I'm having a lot of stomach issues and lots of problems. I've had a lot of chest pain associated with this as well because since I have a hernia, what's happening is my stomach is actually traveling up into my hernia and pushing on my chest wall, which makes me feel like I'm having a heart attack, which is not a good thing. So, but I've been dealing with this stuff for years, but in the last like 6-7 months, it's just been really bad. Next question, did you have your hernia removed yet, or is this separate from this? This is separate, but it's part of the hernia attempt to surgery. So this is my next step, and then after I get my results and it comes back that I do need the surgery, I should be able to schedule it, and I'm hoping that it happens before the end of the year, but I don't really know. Next question, do they think the acid issue is separate from the hernia or in addition, or is this to decide? You know what? I don't know. I have no idea. Once they fix the hernia, I think we can fix the acid problems, or at least control it, but the hernia has to get fixed first. So I don't know. And my brother says, fancy, are the doctors gonna figure out what's up? That's the idea, Philly. All right, the next question is, did it move around a lot when you slept? Not really, because it's like really dang secure right here. So this doesn't move, but like I said, this little pack, that was kind of more the hindrance than anything. The next question is, what's the next steps? How will you be monitoring your pH levels? Help make you less miserable? So this is just like for their records, so they can analyze the data, see what's going on, and then give the information to my potential surgeon and then my like general doctor. And then the next step, like I've said, surgery on the hernia, and then we'll address the stomach acid issues after the hernia is healed. Let's see, when did you first notice something was wrong with your stomach? Do you have any symptoms, question mark. So I have had these stomach issues since I lived in Fargo, and if you guys have been following me for a while, I lived in Fargo like 4 years ago. That's when I first like noticed that I was like, oh, I'm having a little problem with reflux, and weird, you know. But anyways, but like I said, about 6-7 months ago was when it really like started to take a toll on my life. So yeah, that's what I noticed. Someone says, do you plan on releasing this fashion accessory to the public market? No, I wouldn't wish this on anybody. And it says, oh, follow-up question, has Vogue contacted you yet? No, but I'm pretty sure Anna Wintour is gonna call me for sure. For sure. This person says, can you elaborate on your symptoms and how it came to be that you needed this test? Really, the reason I needed this test is because when I had an endoscopy, they found the hiatal hernia, and to get the surgical procedure to fix that, I needed to do a couple more tests. So that's the issue. And no one really, so I went to this place, it's called Minnesota GI, that does this. And this is like a very special procedure. They only do like one a day, but they only do them on certain days. And there's like a specialized nurse that does it for you that is the only one that basically does them. And this is not a normal thing that they do normally. Like they only do a couple a week and then that's it. So, and they're the only, I don't know if they're the only one in Minnesota, but they're the only one like in my insurance provider, you know, in Minnesota. So yeah, kind of crazy. This person says, not about your nose. Have you done an endoscopy? Yes. On you, or a colonoscopy, not a colonoscopy. You know, I've never had one of those done. But yeah, endoscopy, that's what I had done when they go down my throat, and then that's how they found the hiatal hernia. Someone asked, are these tests common? No, like I said, they don't do them very often. Yeah. Let's see. And this person says, what are they testing for? They're just testing my pH levels to see where they're at, and gonna analyze the data and send it off to my doctors. It says, what's the next thing you have to have done after the results come back? So after the results come back, then I hopefully, fingers crossed, I'm gonna get the go ahead to schedule my hiatal hernia surgery. So that is the goal. This person says, did they figure out / fix your migraines? No, that is definitely gonna be like a 2020 problem, unfortunately. I've got so much other stuff going on that I am just literally putting a Band-Aid on that at the moment. And it looks like those are all the questions that are popping up. So anyway, thank you guys so much for the questions. I am gonna go to work now. It's about 6:30 and I am gonna jet, and then I will be going to my appointment around 10 o'clock, getting this thing out, and then I don't know what's gonna happen, but I've had I don't have a migraine, but I definitely have a headache. So hopefully that'll go away. I don't know if it will, but we're gonna try, darn it. We're gonna try. But, oh, here's the dog. Doyle, there he is. He's a dog. He's waiting for me to leave. Yeah, but I am gonna jet, and I will see you guys either when I get to the doctor or when this is removed. So I will see you in a little bit. Yay, I've got no more nose hose. Oh, feels very freeing now. So yeah, they just pulled it out. Well, didn't just yank it out, but give them my monitor. They have everything. They're gonna load all the data and analyze it, and then in about 2 weeks I will get the results, and then my physician will also get the results. So very excited about that. And I didn't have to change the tape on my nose or my cheek, but I did have to change it that was over here. So it stuck pretty well, but unfortunately I gotta go back to work. I thought I was gonna be able to go home and take a nap and then maybe log in a little bit later, but there are just some pressing issues that need to be taken care of that I need to deal with. So yeah, but that is gonna be it for this vlog. I hope you guys just enjoyed a peek into what a 24-hour pH test looks like for me, and hopefully when I get my results I will be able to schedule my surgery. So I will keep you guys posted on social media and all of that good stuff as to you know, when it's happening. I'm probably not gonna tell you like when it's scheduled, but I'll like let you know when it's happened and all that good stuff. So anyway, I'm gonna jet. Thank you guys so much for hanging out. If you liked it, make sure to give it a thumbs up, subscribe, do all those things those YouTubers tell you to do, and I will see you guys in the next video. Bye.
Well, folks, it's time to kick it old school.